My name is Flavio Malcher, and I am director for the Abdominal Core Health Center here at NYU Langone. My main focus here at NYU inside the Center for Abdominal Core Health is to manage diseases that happen on the core of our body, our abdominal core. Mainly, those diseases are hernias, but not only hernias. We can have other problems on the core as a diastasis, a growing tumor, or chronic pain. A hernia is when something is out of its place. What we call a hernia on the abdominal wall, the most common hernias that we have, is when there is a hole, there is a gap on the muscles of our abdomen, most likely on the anterior or lateral aspect of it. And through the hole, something comes out. And that defect characterizes a hernia or the abdominal wall. Most of the hernias, they require some time of surgical management to be treated. The question is, do I need to get it treated or managed or not? That question can only be answered by visiting your surgeon to make sure that your type of hernia will be safe to a watchful waiting. Most of the hernias, they need to be prepared and electively managed. We want to avoid to get the patient to the point they need the emergency operation. I'm always surprised when the patient comes to my clinic, and sometimes they think there is nothing to be done. And almost all the time, that's something that can be done. Being able to really specialize myself and my team on abdominal core issues has given us a big advantage of really understanding a deep knowledge of those presentations and try, again, tailor the approach for each patient. Fear is something natural that we see every time we tell a patient that we need to do a surgery. That is completely natural and human. But nowadays, general anesthesia is pretty safe. Most of my patients, probably 4 or 5 out of 6, can go home the same day. So they don't even need to spend a night over the hospital. All we need is a good and honest conversation with the patient. We have here professionals and different specialists that can prepare what we call pre-optimize our patients prior to surgery. We are not in the business just for doing surgery. We need to prepare the patients, understand what is the best approach, then do the surgery, and then rehab those patients so they can go back to their fulfilled life. It's very exciting to bring this concept of abdominal core health to NYU. We are the first abdominal core center for the New York City area. The other centers that exist in the area, they are only focused on hernia disease. Our idea is to give this holistic or comprehensive approach for all diseases that happen in our core. Again, it includes pre-optimization, surgical repair when necessary, and post-op rehabilitation.